The testimony now turns to children's injuries, beginning with findings involving Dawson and Callan.
For Dawson Clancy, I examined the eyes as well.
And what were your findings?
The findings were that there was also some acute hemorrhages in these muscle and adipose tissue surrounding the eyes. And then the right eye had some small hemorrhages in the posterior retina and the optic nerve sheath. So the back of the eye, there's the retina within the eye, and the retina connects with the optic nerve at the back portion of the eye. And in this case, there was a little bit of hemorrhage at that connection point where the retina connects to the optic nerve.
And what is hemorrhage?
Hemorrhage itself is just blood that is no longer contained in a blood vessel.
So it's burst from that vessel?
Correct.
And then in terms of Callan Clancy, what did you examine with Callan Clancy?
For Callan Clancy, I examined the brain, the dura, the spinal cord, and the eyes.
And what were your findings?
The findings were that there was hypoxic ischemic changes. Essentially, that means that there has been some sort of incident which has caused the brain to have a certain period of time in which blood and oxygen flow were not appropriate. So in this case, there was a time frame in which there was no blood going to the brain, there wasn't enough oxygen going to the brain, and the brain will show certain findings in these sort of circumstances. One of the things I note is that there's edema. Edema is when the brain starts to swell. Edema is also a very general finding. It can happen in many instances, but the edema basically means that the brain starts to swell, so you don't have the nice kind of bumpy pattern on the brain. It starts to swell up and it gets a little more flattened because the brain is encased in the skull, so now it's pressing against the skull because it's swelling up and getting bigger. One of the other things I noted with that was that there was compression of the ventricles. So the ventricles are almost like a tunnel system inside the brain that allow for the cerebral spinal fluid to flow through the brain and go into the spinal cord. And when the brain starts to swell up, it not only swells up outwards, but swells inwards on itself as well. So these ventricles that are located in the inside portion of the brain are starting to get kind of squashed because the brain is swelling. Another thing I noted was that the brain was diffusely friable, meaning that it's very soft. So one of the things I do on all my brain cases is they go into formalin. The formalin allows them to fix, which basically firms up the tissue. And it makes the tissue more easy to manipulate. A fresh brain coming out of a skull is very soft. It's very easy to damage it. It's very easy to put your fingers through it if you're not careful. So one of the things that gets done is these brains will go into formalin. I typically will let them fix for about 2 weeks or so. And sometimes, regardless of the fixation time at the formalin, sometimes the brain still will not firm up the way it should, because if I'm receiving a brain and it's already has hypoxic ischemic changes, the formalin is only going to penetrate the tissue so much because the tissue is essentially already dead.
Can I just stop you for a second? What is hypoxic ischemic changes? Hypoxic
ischemic changes is when you are getting lack of blood and oxygen flow. So hypoxic is the oxygen portion and ischemic is the blood portion.
So what you saw with Callan's brain was consistent with a lack of blood and oxygen?
Correct, yes.
The examiner is describing physical changes to Callan's brain consistent with it being deprived of both blood flow and oxygen.
To brain death?
Correct, yes.
How long, based on your training and experience, does it take for a brain to start dying after the loss of blood flow and oxygen?
It varies based on different sources. Most sources say it's between about 6 to 8 minutes. If there is no oxygen flow, then the brain will essentially start dying. It depends on, if there's resuscitation that occurs afterwards, but it's generally in the frame of 6 to 8 minutes or so.
And once brain tissue dies, it can't be brought back, correct?
Correct, yes.
I have nothing further. Thank you.
You're welcome.
Rayton.
Come off calls.
Hold on, here. Counsel, hold on. We're going to take a short break, all right? So why don't we, this will be a very short break, come out, we'll come right back, okay?
Court, all rise. Jury, close the notebooks. Please come to chairs, please. This way.
Session.
We'll be in a short recess in the courtroom.
Everybody, clear the court.
Court, all rise. Jury's entering. This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Well, members of the jury, I just kind of want to revisit an instruction I've given you a couple times, I think, during the course of this trial. It's important to understand and remember that sometimes there's evidence that's presented in the trial that creates an emotional reaction. But as jurors who have taken an oath to follow the law, I'm instructing you that the law says you must separate any emotional reaction on your part from the informational value and weight that the evidence produces. Your verdict in this case is going to have to be based solely on the evidence, and it's not going to be, it cannot be based on sympathy or anger or passion or prejudice. All right? So you've got to keep that in mind. And so with this, we're going to go to the next witness. Okay.
Commonwealth calls Dr. Barbara Vidal Olson.
Same objection.
All right. Same finding and analysis.
Afternoon, ma'am. Sound like you raise your right hand to the clerk, please.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give before me be the truth, the whole truth,
I do.
Thank you. You may have a seat.
Watch your step.
All right. Good afternoon, doctor.
Good afternoon.
All right. I'm going to ask you also to keep your voice up so the jury can hear you and speak into that microphone if you would.
Okay.
All right. Ms. Sprague.
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
My name is Dr. Barbara Olson, B-A-R-B-A-R-A-O-L-S-O-N. I previously practiced under my maiden name, Barbara Vidal, V-I-D-A-L.
Can you describe for us your educational background, please?
I completed my undergraduate studies at the University of New Mexico. I also completed 4 years of medical school at the University of New Mexico School of Medicine. Afterwards, I came to Boston to study the field of pathology at Beth Israel Deaconess Medical Center. I completed a 4-year residency program there, studying both anatomical pathology and clinical pathology. And after my residency, I did a surgical pathology fellowship studying the gastrointestinal tract, liver, and pancreas, and I ended my training doing a fellowship of forensic pathology at the Boston office of the Chief Medical Examiner. I am board certified in anatomical pathology, clinical pathology, and forensic pathology.
And what is forensic pathology?
It is essentially the study of causes that are diseases, disorders, or trauma that results in sudden, unexpected, or non-natural deaths.
And do you currently work at the Office of the Chief Medical Examiner?
Yes, I'm a medical examiner at the Cape Cod office of the Chief Medical Examiner.
How long have you worked there?
Since 2021.
And approximately how many autopsies have you performed?
I have examined over 1,900 bodies and performed over 800 autopsies.
This is Dr. Barbara Olson, a board-certified forensic pathologist who performed Cora Clancy's autopsy the following day.
And When performing an autopsy, is there a specific process or procedure that you follow?
Yes, so an autopsy is composed of many parts, the first part being documentation review and the second part being the examination of the body, which is broken up into two parts. The first part being the external examination, where I look for identifying characteristics of a decedent, such as eye color or hair color. I also look for any evidence of natural disease or trauma on the outside of the body. And the second part is the internal examination, where I create a Y-like incision on the chest and abdomen and examine the soft tissues, bones, and organs, looking for any evidence of natural disease and trauma. I also examine the brain.
And did you perform an autopsy on Cora Clancy on January 25th, 2023?
Yes.
And did you follow that same process with Cora Clancy?
Yes.
And so that started with a document review, is that correct?
Yes.
And what type of documents are you reviewing when you do that?
Typically, I have a preliminary police report to review, as well as either EMS records or records from the emergency department.
And did you start with an external examination of Cora?
Yes.
And what did you observe during that external examination?
The external examination of Cora, I saw evidence of medical intervention. She was intubated, had various EKG pads and defibrillator pads on her body. She also had a catheter on her right hand and puncture sites on her left hand and her left groin. She had her neck stabilized with a cervical collar, and she had an intraosseous catheter, which is a type of IV they put directly into the bone on her right lower leg. Her hands at the time of my external examination were covered by police evidence bags, and they were secured at the wrist with tape. When I removed those, the fingers showed no evidence of injury, and the fingernails were all of equal length and intact. And then I noted evidence of trauma of the neck with associated injuries of her head and minor injuries of her right arm and of her legs as well.
And in terms of the injuries that you observed, evidence of trauma to her neck, were there also injuries to her face and neck area that seemed to go along with the trauma to her neck?
Yes, there were findings of the head that were associated with the trauma of the neck.
And what were those?
So on her neck, she had a ligature furrow.
And this is where Dr. Olson begins detailing the specific trauma she documented during Cora's autopsy.